All right, we are back and live once again tonight. I'm happy to have Joint Health and Wellness of Georgia joining me on the show. They're going to introduce themselves, and you'll get to meet the team, and you're going to get to meet Barbara Hall. She is the head in charge that you will be getting treated by, and I want everybody to be able to relax, understand the process. So let's start this off, and let's bring Amber Kempson in. Hello, Amber.
Hey,
How you doing today?
great. How about yourself?
Good. Welcome to the show. You're the one that will be intercepting the calls, correct?
Yeah, so when you
Okay.
call to schedule your appointment, you are probably going to speak with me.
Hmm.
Like you said, my name is Amber, and I'll be the one answering the phone calls. And then I will get all of your information, such as your name, your date of birth, your phone number, your insurance information, and we'll set you up a chart. And then what happens next is I'll get your insurance information. I'll get that handed over to Kendra. So the cool
Okay.
thing about Joint Health and Wellness of Georgia is what we strive to do is help people the best that we can, and that being we like to go ahead and call the insurance company before the patient even steps foot in the office.
Okay.
That being said, because each and every plan is different, so we like
Hmm.
to get a personalized information from the patient's own insurance company representative. So we
Okay.
call and tell them this is it. We do pretty much do the same thing over and over. So people for arthritis, so we will call the insurance company and we'll get the step by step as to how much they'll pay and how much you'll pay. And then
Hmm.
we like to have that information up front for when the patient walks in. There's no surprises or gimmicks when it comes to their money. So get that information from you. Then we'll get an appointment schedule from you. And then once we have that scheduled, your day of appointment, you'll walk in the door and I'll be the first one that you see. And I'll give you your new patient paperwork. I'll take a copy of your insurance card along with your ID. I'll have you, if you have a copay, I'll take that copay and then get all your information scanned into our system, give you your license and insurance card back, and then I hand all that information over to Kendra. And then that is when she will do a detailed health history on you before
Okay.
you meet Miss Barbara.
Okay. Very good. Well, that's awesome that all that's done beforehand, so people can just come in and already know what their part's going to be and how much they're going to owe, and take all that off. So, with that said, let's bring in Kendra Thompson. Kendra, welcome to the show.
Hey, so I am the insurance coordinator at Joint Health and Wellness. I'm the one who
Okay.
gets all of your benefits and requirements handed over to Barbara so that you know what you're walking into.
Okay. Very good. Well, before we bring Barbara in, Joint Health and Wellness of Georgia's main goal is to let everyone know that surgery is not your only option when it comes to knee replacement or shoulder replacement. And although we primarily specialize in knee and shoulders, nurse practitioner Barbara Hall has 30 years of experience in orthopedics. It can help with other joints as well. So let's bring Barbara in. Barbara,
Hi.
welcome to the show.
Thank you so much. I'm Barbara Hall. I am the nurse practitioner. My husband and I own this clinic. So we love having new patients. Of course, this clinic is a ministry for me as well. So my goal every day, and I have two amazing staff members who love on these patients. First and foremost, we treat you like family. But I want to talk a little bit about what we do once you're in the back with me. So Kendra will take you beforehand and talk to you about a health history. We want to know everything, all the medicines that you're taking, all of the treatments that you have tried on your knees or your shoulders, if you've had injections, if you've had surgeries, anything like that, to help me make a plan for you once I get you back in the back. Once we get all that done, I bring you back. I go over that information a little bit more, see if there's any questions that I have about anything else, need more detail or anything like that. And then we go forward with x-rays. The clinic, I just want to start and say first and foremost, this clinic exists for people who do not want to have a knee replacement,
Okay.
or who can't have a knee replacement. People have, some people want to have their knee replaced, but they can't because they are too sick. They're too heavy. A lot of people are turned away because their weight is too much.
Okay.
and they are frustrated because their knee hurts so much that they can't exercise and lose weight, but they can't have the surgery to get rid of the pain.
Right.
Then we have folks that just don't want to have surgery because they know someone that had a bad result, or they had a bad result. You know, they already had one knee replaced and it was a bad experience. And so they're looking for another option. So we offer a conservative treatment. It is minimally invasive. It does include injections in the joint, but
Okay.
it is much, less invasive than a big knee replacement surgery. So we take the patient back and I talk with them a little bit, and then I do a physical exam, and I'm going to poke and prod all over your knee, move it, straighten it, and, push on it and see if I can find where you're really hurting, and, kind of get the most comprehensive story about what's going on with you that I can. And then we do x-rays. I have a small machine in my back office called a mini C-arm. It is a fluoroscopy machine, and I can do x-rays in real time. I can take still pictures of the knee, but also I use it during my injections, and I can watch myself doing the injection. You press the button down and you can see the needle going in. You can see the medicine coming into the knee. And that helps me to ensure that I'm doing, that I'm putting the medicine in the right place. Okay.
Right. Okay.
And so we take still pictures, and then I'm going to pull them right up there immediately and talk to you about your x-rays. Some people have seen orthopedic or seen, their primary care, but they have never had their x-rays explained to them. They just say, oh, you have arthritis, you're bone on bone, whatever. But I like to show them what your knee looks like. This is why you hurt right here where you're pointing to. This is why. And then we go over the x-rays really comprehensively. And then I tell them about, what I think the best plan for them is. And sometimes I tell people that this program is not for you. This is not going to help you. And sometimes I think that they're the greatest candidate, and so there's certain things certain criteria that you have to meet for insurance to pay for this program. You have to have done some conservative treatment for a certain amount of time before they'll.
What would an example of that be? Conservative treatment.
So they want you to have been having knee pain for at least 90 days.
Okay.
Okay, you can't turn your knee in a hole in the yard and come in and get HA.
Gotcha. Okay.
So you have to have been hurting for a certain length of time, and you have to have tried certain things, which would be anti-inflammatory medications by mouth, topicals like rubbing BioFreeze or Voltaren gel or something on the knee, bracing, icing, heat pad. What else, girls, am I missing? Other injections, if you've had a steroid injection or something in the past.
Physical therapy.
Yes, physical therapy. So any of that stuff, I want to know everything that you have tried to make that knee feel better on your own before you came to me. Then you have to have tried a certain amount of those things. You have to have been hurting for a certain length of time. And so because the program is expensive for insurance too. So they're not going to jump right into doing that.
Yeah.
And then we get you, and then after I've kind of see where you are, and, I grade the degree, the severity of the osteoarthritis. And then we talk about what we're going to do. And basically this is the spiel I tell everybody. I tell them that this is a conservative treatment. This treatment does not make your arthritis go away. You still have arthritis. You still have joint space narrowing. You still have bones grinding on each other. You still have all of these things. But what our program tries to do is change the environment inside the knee to make the knee more comfortable. Okay. Because the only thing that takes arthritis away is a knee replacement.
Oh, wow. Okay.
So, because a lot of people have, the three things that I look for on an x-ray are, narrowing on one side or the other of the joint, and bone spurs, and then inflammation in the joint. The only thing that I can really kind of permanently change is the inflammation. We can't change the bone, the bones rubbing on each other. We can't take away bone spurs. Nothing takes that away besides a knee replacement. So especially when I have somebody come in whose knees are super severe, we talk about expectations too.
Yeah.
Because you're not, my goal with this program is to decrease the pain and increase the function by 50%. For
And would
some
it be,
people,
would it be, other than knees, like elbows, wrists?
so yeah, insurance in this country will only, the gel that we inject is only approved for hips, shoulders, and knees.
Okay.
In other countries, it's approved for ankles and elbows, but not here.
Okay.
And I don't do hips because my X-ray machine is not big enough. It
Gotcha.
it is for smaller joints. So I tell people, here's what we're going to do. We're going to manage expectations. The way we treat people, the three main things that we do here at this clinic to help your knee feel better is a three-prong approach. The first is injections of a medicine called hyaluronic acid. This is a lubricating gel. Orthopedics offer it in their office. It is the same thing. It's the same brand usually. The difference in my office and your orthopedic office is that I use a machine to do a guided injection. I watch myself put that medication in, and I know that it's going in the right exact place that it's supposed to be. The joint is enclosed in a joint capsule. If that capsule is damaged, or if, for example, the person who's injecting it misses the capsule, goes all the way through it, or goes around it and injects that medication into the knee outside of the capsule, it does absolutely nothing. It will not work. And it's also incredibly painful. So
now, is it painful if you miss, or painful in general?
It's painful if you miss.
Okay.
Most people do just fine with the injections. Of course, you have some people whose pain level is, their pain tolerance is much lower than others, but most of the people come in and they're very nervous. And the first, when I'm done, the whole thing takes about 20 seconds. And when I'm done, they're like, that's it, and I'm like, yeah, that's it,
I think, if you don't mind, let's hone in on that just a little bit, just to help anybody that can see this beforehand, because when anyone hears injections, it's like, oh my God, injections, you want to, run and hide. So literally and again, like you're saying, there's different pain tolerances, but there's also the psychological aspect of building things up mentally, dreading it. So like you're saying, 20 seconds, it's done, right? And what would it be? Maybe this is a silly way of asking it. Would it be to a bee sting? Would it be to?
Well, I've never had it. I haven't had it. I haven't been injected, but I'll tell you that most folks, they describe it. Of course, when you puncture the skin, that is an injection, just like when you get a shot in your hip. And they feel pressure. They feel that medicine because it's quite a lot of fluid, and they feel it going into the joint. So they say, I feel pressure. And most people tolerate it just fine. They do just fine. There's no downtime with these injections. You're not going to have to go home and put your leg up because you can't walk. You're going to, I have folks who come in at 8 o'clock in the morning and go work and stand in a factory all day.
So really, if it's targeted properly, they're going to feel better right after the procedure. It's not it's not like a scar to heal up. You haven't been cut on. You haven't had, like I said, the knee replacement. If they're a candidate for it, it's just going to be actually a pleasant experience, because I'm sure when you have, very, deep knee pain, that injection doesn't even compare to the pain that they've been receiving.
Correct. And that's often how we know that people are really ready for this, because they'll say, it can't hurt as much as my knee hurts now. I'll try anything. And so they do it, but most people feel better before they leave the office. As far as the psychological, the fear of everything, that is why we structure our clinic so much differently. We're kind of a boutique clinic. I don't have a waiting room full of nervous people. I try to schedule your appointment, so you're one of the only people in there.
Okay.
And of course, Amber is just, Amber and Kendra are just so sweet, and they just love on the patients. We bring them back. I am the queen of talking about nothing while I'm doing the injection. I'll talk about your dog.
Cindy Park said Barbara is so compassionate and knowledgeable, so everybody can relax and come in, right? And that's a good point that you just made, is when you're sitting around waiting in a doctor's office for, hour, 2 hours, anxiety just naturally builds up, right? So,
and every now and then, if they'll get to talking to each other, the patients will get to talking to each other, and they're like, "This is my first time. Does it hurt? Is it terrible?" And literally 9 times out of 10, they'll be like, no, it's fine.
Yeah.
It's fine.
And that just stimulated another question. Sorry. So
Yeah.
how often would someone need to come back for the next injection? So what, if they're a good candidate and it takes, what's the average length of time before they have to come back and
So
fill back up the tank?
I can't. So the program, depending on your insurance, of course, insurance runs the show. They tell me they all contract with different medication companies.
Mm-hmm.
And so they say their preferred brand of HA, of hyaluronic acid, is this one or that one. And they're different series. So some of them are a 3 injection series. Some of them are a 4, and some of them are a 5. But you're going to come back no sooner than 7 days.
Okay.
I can't see you before 7 days. And so you'll come back every 7 days for 4 weeks, 5 weeks, or 6 weeks. And then insurance will not pay for you to repeat these injections again for 6 months.
Wow. Okay.
So you can come back again in 6 months and a day, and we can start over if you choose to.
Right.
So the injections are, I mean, you know, I know that is a big, scary thing for people, but that is like, you're fine. It's fine. I've been doing this a long time. I'm really good at it.
Yeah.
So, and we'll talk about your grandkids and your dogs and the deer in your front yard and whatever. I mean,
And bring tomatoes.
Yes. My husband is a tomato grower, so we bring tomatoes and squash and feed all the patients. And so.
What'd you say, Kendra?
They bring us plants, all kind of stuff.
All sorts of goodies. Yeah.
The patients bring us flowers and food, and it's just like we have a little family.
Yeah.
Yes.
That's awesome. Well, let's do this. Amber, you're taking in the calls, and then I want to go to Amber and Kendra, and Kendra, and then Barbara, and let's kind of address some of the main questions that you're fielding, right? So that way, if it's a common question that's being asked, and obviously that can help answer some questions before they even call. So Amber, what would be rings? Someone calls. What's the popular questions you're receiving?
I would say it would probably have to be, does insurance cover it?
Okay.
And then I explained to them that we'll take their insurance information and we'll hand it to Kendra. Kendra will personally call on that plan. And then we have those numbers before they even walk in the door. And another question would be, I always get, does it hurt? I guess because I'm the first one they see, and
yeah,
it's just they're wanting to get that off their mind real quick. So I always smooth them up, like, you're going to be fine. Barbara is awesome. She's going to take really great care of you. She goes above and beyond for her patients.
They get mad at me because I spoil them rotten.
Yeah, that's a good thing, though.
Yes, but I do also want to touch on, because we didn't get past, once you get done with your injection, this is one of the patient's most favorite part of the whole entire visit. Like Barbara said, you can come once a week, every 7 days. So people call this like their spa day, because after their injection, they get to go in what's called the icing room. And after your injection, you get to sit in this big massaging chair, full body massaging chair. It relaxes you all the way back, so you're able to elevate your knee and put some ice on there. And then we have the lights dimmed in there. We have a lamp, and we also have refreshments such as coffee, water, graham crackers, all kinds of things.
That is like a spa. That's what they give you after you get a massage. You get to go in there and have a little snack and
there's candy everywhere in the office.
Yes, candy everywhere. But then they'll sit in there. We'll set a 10-minute timer. Of course, you can stay longer if you'd like, but that's usually about 10 minutes is pretty good. And they can listen to music. They can play on their phone. Some people, they just kick back. Some people even snooze.
Fall asleep.
Yeah. But I would say another thing that I would say that my patients would ask would be, what would you say, Kendra? What do you get?
How much is it going to cost?
I get a lot of specialists. And so
say that again, Kendra. You lagged a little bit.
So how much is this fee going to cost us?
Okay.
Oh, hang on. Sorry, guys.
That's right. Is
that better?
Yep. There you go.
I get a lot of.
Yeah, you're freezing. That's all right.
Right.
Singing.
I
That's all right. It's okay. So basically people are calling once you find out, going, okay, how much is my copay going to be, or how much are in other words, like Barbara said, depending on the insurance and the medication, how many injections can they get? Just actually, I guess the procedures that they qualify for. Would that be a good way of putting it?
So the girls can't answer those questions because we haven't seen the patient. So
okay.
We go ahead and run the numbers as if we were going to do the whole thing. And so, but they can't really give that kind of information over the phone. All they can tell you is it's going to cost you this much to see Barbara today.
Oh, okay. Gotcha.
You know what I mean?
Okay.
Because we can't diagnose you over the phone.
Correct.
And so we, but I have a whole, like a financial sheet made out, and, and I'm like, my staff has talked to your insurance. We tell them every code we're going to bill. And then they say, this is how much co-insurance you have to pay, how many, your co-pays and all that stuff. And this is how much it's going to cost you to treat your whole left knee.
Okay.
This is how much you're going to pay out of pocket. And we're pretty good we're pretty accurate most of the time. And then, so that's how we do the financials, because we can't tell them how much how much something's going to cost if we haven't seen them.
Well, true. Right. It's kind of like, not to compare, like having a issue with your car, you call the shop and go, hey, my car's making a noise. What is it? Well, I don't know. You got to come in. Let me diagnose it. So with call, Amber picks up the phone, and then when Kendra looks in the insurance, and Barbara, before you see them. So the only way to, identify a candidate for your program is going to be you seeing them. Correct, Barbara?
That's right.
It can't be done through Amber or Kendra. They're still going to have to come in and get that appointment with you to find out if they're a candidate for this treatment.
Yeah. And now certainly, when some people come with certain questions, and I can answer on the phone, no, you need to go see a surgeon,
Okay.
For example, they call me and they say, I just had an MRI on my shoulder and I have a full thickness rotator cuff tear. Nothing I do is going to fix that. You have to have surgery.
Okay.
And so I'm not going to waste your time or your money coming in here for me to tell you that. I'll tell you that over the phone.
Right.
But if it's something that is kind of like, it could be this, it could be that. Yeah. Why don't you come in? Let me take a look at it.
Gotcha. Okay. Well, I'm gonna put this up, and if you would just kind of go through those 5 points and cover those, like, kind of already mentioned what you offer, which is the injection. So, but you do also do steroid injections.
So I do steroid injections as part of the treatment plan. Usually we get one steroid injection. I have to do an injection before I start putting in the gel. And that is called an arthrogram. And that is a test to look at that joint capsule that I was talking about before. We want to make sure that joint capsule looks great, that it's nice and healthy. Because if there's a hole in it, then all of that expensive medicine is going to pour out into the knee, and it's not going to work. So we do a test first. And because you're getting stuck for that, I usually put in a little Toradol or a steroid just to make it worth your while. And it also helps to kind of decrease the inflammation in the knee so that the HA doesn't have to work so hard. Steroid is a wonderful thing and people love it, but it is a Band-Aid. It is not a permanent fix. It does not fix anything at all. So while it makes you feel better for a little while, whatever problem you had is going to come back eventually. And so the HA is not like that. The hyaluronic acid actually lubricates that joint and changes the environment inside the knee for a long term. The nice thing about hyaluronic acid is that while we can't go, like I was telling you, we can't undo the damage that you have to your knee, we can stop the damage from progressing with hyaluronic acid. If you have a moderate arthritis, we can keep it from getting worse by doing these gel injections. And so that is, the difference in a steroid and the HA injections is that steroid is just a Band-Aid. It's going to make it feel better for a day, 2 days, 2 weeks, 2 months. But it's not going to last because you haven't changed the fact that you haven't fixed what's going on in there.
Yeah. What is the PRP?
So PRP stands for platelet rich plasma. And that is an injection where we draw blood from the arm and we take that blood that we draw out of your arm and put it in a centrifuge and
Okay.
separate the red blood cells from the plasma.
Okay.
The plasma is very high in all of the healing factors in your body. It is high in white blood cells. It's high in clotting factors, all of the things that when you have an injury, they go to that area and they start to heal your body. That is all in your plasma. So if you have a soft tissue injury, say like a tendonitis or a meniscus tear or, elbow tendonitis or anything like that, that can be helped with PRP, we can do that. We can inject it right in that area. And basically what it does is mimics an inflammatory reaction.
Okay.
So like when you turn your ankle and your ankle swells, what's happening is there's plasma has rushed to that area to start healing the damage that you did when you sprained your ankle. And so what we do, if we inject it into your elbow, for example, it starts an inflammatory reaction that starts the healing process. It gets all your body notified that you've injured yourself there, and it starts healing that tendon so that it can feel better. The bummer about PRP is that it's not covered by insurance. It's a self-pay.
Okay.
But it, for a lot of people, it works great. I don't really put it in knees very much or in arthritic knees because arthritis is a bone issue. It's not a soft tissue issue. But it works well for soft tissue things.
Okay.
Tendonitis, meniscus tears, that kind of thing.
Okay. And all, we've already really covered all the other stuff. The other 4 items has already really been discussed. So let me ask you this. Obviously, at CareQuest, we're specializing in mostly seniors, of placing them into assisted living or memory care if they need that, or maybe they need, in-home care. So for the seniors that come into your practice, now, obviously, as we get older, our joints wear out regardless, just like my mom has. And Amber, me and you're Southern here, so I hope I don't butcher this word, osteoporosis. Did I say that right?
Oh, osteoporosis.
I was testing you to see if you'd say it right. But yeah, the brittle bones, right? The back. So regardless of, do you have a lot of seniors that come in that qualify for these procedures? Because obviously when you get older, if you can get away with not having to have a knee replacement, that could be spectacular.
Most of our patients are seniors. We've had a couple of 50-something-year-olds, but most folks are 60s and up. Most of them are Medicare age.
Okay. That's awesome to know. Very
Those
good.
are our people.
Yeah.
We love them.
Anything that any of you would like to, I'll start with Amber. Is there anything you would like to add that we may have not mentioned, or something that's come to your mind through the conversation?
We did not mention, did we mention the bracing?
We did not.
No.
You did not.
You want me?
You can.
Oh,
Go
okay.
for it.
Listen to me give that spiel 100 times, but
Yes.
it's another component of the program. The first is the injections of the gel. Second is the use of a special kind of brace that helps realign the knee. So when people have arthritis, their joint is collapsing on one side. So we put a brace on that pushes the knee in one place, pulls on it another, and realigns the femur in relation to the tibia so that the two surfaces don't grind on each other. It's another way that we keep those two bones from grinding on each other and causing that inflammation.
Now, my uneducated view of that seems like it would help the procedure last longer, right? Because you're helping correct something that's off.
Correct. We tell people, I only ask that you wear the brace while you're in treatment for that 3 to 6 weeks or 4 to 6 weeks. But some people wear them all the time. And I have over time seen people change their alignment in their knee to a more of a permanent change. If you only wear it for a couple of hours every day, it's only going to help while you're wearing it.
Well, wouldn't it be true? Because like sometimes, like I'm flat-footed. And so you can look at your shoes and the heels of your shoes and see where you're not stepping properly. Like if some people, the inside of their heel will wear their shoes quicker, the outside, et cetera. So I could see the importance of having a brace to go along with the procedure to help keep things aligned.
And it does, because when you have knee pain, you are eventually going to have hip pain. You're eventually
start favoring it. Yeah.
And
Amber?
even when patients are out of treatment, like when they're in between their treatment series,
Mhm.
patients still like to wear the brace just because they've gotten so used to wearing it, and it provides that extra stability.
Support. Yeah.
Yes, and it gives them that comfort of knowing that that certain knee brace does not allow your knee to buckle and
Mm.
collapse on you, so you have hopefully a less chance of it buckling and you taking a fall and then
Yeah.
injuring something else.
Yeah. And I think everybody's experienced, walking along, your knee give out in
Yeah.
mid stride.
Yes.
That's a weird feeling.
But
Yes,
some
it
Maybe,
people
is.
have that happen every time they stand up, every time they
what
walk, the knee
that is,
buckles.
wonder what the world is going on with that. That is a weird feeling.
Yeah. So the brace helps that knee will not buckle when you're wearing that brace
Mm.
because it's metal.
Kendra, anything you want to add that may have come up or?
Kendra, I want you to tell what kind of insurance we take.
Good one.
So we take pretty much all major insurance companies. As far as Medicaid goes, we take it, but it has to, unfortunately, be only your secondary. We do
Okay.
not
All right.
take Oscar, no Kaiser.
Okay.
Some Cigna Medicare policies do not like us either.
Okay.
I have a couple that like us, and then I have a couple that really don't like us.
Yeah.
Um, we're still teetering on the edge with WellCare. We're trying to get in the loop with them. It's a little bit harder, but we are working our hardest to get in loop with them. So pretty
But
much, I would say every insurance company.
we do
Okay.
take Medicare, Humana, Aetna,
Okay.
United Healthcare,
Yep, all the
Blue
majors.
Cross Blue Shield.
Blue Cross.
This may be off base, but I need to bring it up in case it is something here. Like, for example, we have some colleagues that they specialize in the Medicare, Medicaid side. Is there anything that they would be able to do to help to see if someone's pre-approved for this? Like if someone wanted to call their insurance representative or say, we have because every time a client comes to us that we're looking to help find in-home care or place them, we always ask those questions. Like, is there a veteran in the family? If so, we'll connect them with a professional there to make sure that they're not, not getting some money they may be entitled to. Same with Medicare, Medicaid. Sometimes if someone even moves to another county, it changes their plans. So I was just wondering if that is something that they could call beforehand before they call you guys and go, hey, I'm thinking about, calling Joint Health and Wellness of Georgia. Does my plan cover those types of procedures? Is that?
The only thing that because they don't know the codes that we bill,
Okay. All right.
the only thing that they could say, the only thing that if you called your insurance in particular, the only thing that they could tell you is that, yes, they are in network with us.
Yeah.
They could tell you that.
Okay.
But if you have a question and you want to know, we are happy we run in people's insurance all the time to see what it's going to be before they decide to come in.
Gotcha. Okay. All right. Well, Barbara, anything you want to add that we may not have?
No, I think we covered it.
Okay.
Wait, I got one thing.
All right,
We are
shoot.
now doing CPR and BLS training. We
Okay.
can come to you guys, or you guys can come to us. And we have great discounts for groups as well. And another thing is that even if you are already certified and it's about to expire and you need to get recertified, we
Yeah.
can send you a link and you can complete your exam online, and then you'll come into our office or we'll come into you for a quick 5 to 10 minute skill check off, make sure that you perform the skills correctly, and then we'll email you your certification again and you are all good to go.
With you guys having that, I'm just thinking outside the box. If you ever want to do any events at some senior centers or maybe at some of the assisted living communities that we, have relationships with, is if you guys wanted to sponsor an event and come do that certification and also share what you're doing. So if you guys want to do some co-events together, I can be more than happy to get with some of my colleagues and set some things up to be able to come in and do that CPR training, as well as an overview of what you guys offer. Because I know there's plenty of people out there that have knee pain and they would like to know that there is alternatives. So you can kind of be able to let them see that, hey, there's other options available. So with that said, here is the website and the phone number. And there's Amber that will be answering the call. And you see Kendra and Barbara, the team here. And I appreciate you guys taking the time
Thank you.
to come on here, and look
Thanks
forward
for
to
having
working
us.
together and spreading the word and go out there and make a difference for people that are hurting.
Fix them
That's
the
all we want to
knees.
do.
Yep, exactly. So with that said, we will catch everybody on the next show.
All right. Thank you, Mark.